Amina Azad. Welcome to another episode of Mind Reader. In today's episode, I'm going to talk about ADHD. This episode will be in a continuation of two episodes. In this episode, I'm going to talk about what is ADHD and what are the types of ADHD. Before I start, I would always tell you guys so don't forget to subscribe to our Grow Your Reader YouTube channel. Don't forget to like our Grow Your Reader Facebook page, and of course, if you like our video, don't forget to share. So now let's start. So what is ADHD? ADHD is actually a very common neurodevelopmental disorder. It's very common in Bangladesh as well. This happens and you can understand it by a child has a very hard time paying attention or focusing on something. He has a very hard time understanding instructions, and often he just doesn't want to finish. It's not that he doesn't want to listen to you, it's just that it's not in him to finish it up or pay attention to you. So usually it starts in early childhood, and it often stays in adulthood. They also have, along with having a hard time paying attention, they also have a very impulsive behavior. They would do something without even thinking. It's not that they did it intentionally, it's just that it happened. Or they're very overly active. So parents need to be very patient, and they need to really understand that this is very hard to grow out of. This behavior is very hard to grow out of. So let's now look at the fact that what are the symptoms of ADHD. So a child or a person who has an ADHD, like I said, will have a very hard time paying attention to something. Will daydream a lot. Will forget things. Will fidget and squirm. Will jump around, do overly active things. Would not listen to instructions, not focus. In many cases, his impulsive behavior might put him at risk, and this symptoms, this behavior would, if continues, would put the child in a problematic situation, especially with his school life and with his peers and even in the family. So what are the types of ADHD? So the first type is predominantly inattentive behavior. So this happens, like I said, the person has a very hard time. Give him a task, this is the sequence of the task. You instruct him, this is how you do it. But then the child has a very hard time in finishing that task. In most cases, he doesn't finish, and he just leaves it and he wants to go do something else. So you might think that this is something that he's being very stubborn about, but actually no. Is this disorder in him that's not allowing him to pay attention, or not letting him to understand the instruction or the sequence of how to organize certain things. The next is predominantly hyperactive behavior. So this is when the child is really jumpy. All of a sudden, he can't sit still. Especially if you ask him to have his lunch, sitting normally sitting still. This is something he will not do. He will just go hyper or grab something, jump around. At inappropriate times, he will start screaming. He will start doing things that that are very much abnormal. That is when you need to understand that this child is diagnosed with ADHD, and he's starting to develop his impulsive behavior, and this is getting very severe. The other type is a combination presentation. So when combination presentation is that both of them exist, a predominantly inattentive one, even a predominantly hyperactive one. So this is a very serious case. If this happens, that means that the child is in a very severe situation, and the parents need to diagnose it as early as possible, because these symptoms are very hard, or these behaviors are very hard to grow out of. In a combination of these symptoms, and these symptoms remain for a very long time, and this diagnosis also for a very long time. So the earlier the treatment, the better the child is going to recover from. So that's it for today. In the next episode, I'm going to talk about what are the causes of ADHD and what are the treatment for ADHD. So till then, you guys take care, have fun, and bye.